welcome, welcome, welcome to Health Issues. I'm your host, Chris Sylvain, and I am totally honored. A historic show for us in a lot of ways. We're on this series about substance abuse, prescription drug abuse, but just in general, substance abuse. Drugs, the misuse of drugs, and we have two distinguished guests. We have Dr. Reginald Parquet. He's a professor of social work at Tulane School of Social Work, and on the outside and on inside we have Dr. Lonald Daughtry. He's an assistant professor of clinical pharmacy at Xavier University, and both are substance abuse professionals. In their particular subset, they do a great job. Thank you, gentlemen.
Thank you. Thank you.
Appreciate you. All right. So, first of all, tell us a little bit about yourself, and we can start, Dr. Parquet, a little bit about your background.
Okay. Thank you, and I want to thank you for the opportunity for being on this show to discuss a very important issue in our community. I'm a licensed clinical social worker. I've been practicing here in the state for over 30 years. Received a master's and a PhD from the Tulane School of Social Work. Have done a lot of work in the field of substance abuse. One of the courses that I teach at Tulane is a substance abuse course. In fact, it's the largest class on Tulane's campus that averages over 200 students during the semester. I've trained professionals to treat persons who have substance addictions, and thoroughly enjoy that type of work, among other things that I've done professionally.
Awesome. Great. Great. Dr. Daughtry.
I'm currently assistant professor of clinical pharmacy at Xavier University College of Pharmacy. I was trained postdoctorally in psychopharmacology. I taught for several years at the Howard University School of Medicine, as well as College of Pharmacy, and I've been a professor here for about approximately 15 years.
Oh, wow. Awesome. Awesome. And that's why I say it's interesting, because that was the first time having Tulane and Xavier together. We do a lot with Tulane, and definitely working to do a whole lot more with Xavier, so it's awesome. And let's start off right here. We've been doing this series on substance abuse, and even prior to that, our focus had been on prisons. Louisiana incarcerating more people than any place in the world. And New Orleans is a hotbed that feeds so many to this prison system. So we're unique as an area, and I find it's interesting because it's African American men, young African American males, who are the ones that bear the brunt of this level of incarceration. And statistics vary, but say 70% are over drug crimes. And I just find it exciting that, in contrast, we have definitely two great African-American men discussing this. So I think there's really something of value, and I hope everybody would call somebody and tell them to watch it, catch it on YouTube. So let's start right there. This idea of substance abuse, and marijuana is thought to be legalized. It's being legalized in many states right now, and it's moving. I don't know if it'll ever hit Louisiana, but it's legalized. But I'll throw this out. Why marijuana? Could there be a bunch of other drugs we can pick other than marijuana to legalize? And regardless, if marijuana is the best one to legalize, is it that much different where one guy gets 20 years to life for one drug, and the other one they can go purchase it at the 7-Eleven?
Well, I don't know if marijuana is the best drug to legalize or not, but certainly there is a kind of a mindset in this country that legalization of marijuana would have an impact socially on those persons who engage in that substance use. As an example, you mentioned earlier, 70% of the persons who are incarcerated may have some drug-related offense. We know from the data that individuals who commit a crime, 67 to 75% of them are on some drug when they commit that crime. So whether it's marijuana or alcohol or cocaine or whatever the substance might be, we have to, I think, take a very serious look at what a decision of legalization has on the individuals, the family, and the community. I will tell you that if you want to compare marijuana with alcohol, I think alcohol certainly is more destructive, has caused more deaths than marijuana. So one way maybe looking at it like that, if you want to compare marijuana with cocaine, I think cocaine is far more addictive than marijuana, particularly when you start thinking about the impact that crack cocaine has on violence in our community, as well as the incarceration of young African American males from the inner city where crack cocaine is being used.
Your thoughts, sir?
My thoughts, I can concur that it's a socio-economic problem as well as a community problem. One drug being legalized over another, that's a very difficult question to answer. Alcohol, as you said, in Prohibition times, it was illegal and then was finally legalized. It has decimated communities and created havoc in the world at large. I think that studies have to be done to determine. I think this issue is more of an administrative issue as far as lobbying and on Capitol Hill and different public arenas to legalize a substance versus one substance over another. There is really no hard and fast rule to determine the long-term consequences of legalizing one over the other, but we do know that the properties of these drugs are vastly different.
Just to follow up with that, so the decision to legalize or not legalize, the thought is that marijuana is a harmless product, whereas say a product like cocaine is not harmless. In other words, on marijuana, people wouldn't shoot anybody, steal, or rob, but somebody on cocaine would shoot, steal, or rob. Somebody on meth or heroin would shoot, steal, or rob, or break up their family, or beat their children, and steal from their mother.
Well, I think the real answer to that is it depends. It depends on a number of variables. Certainly the substance and the active ingredients that result in the physical and biological changes have to be considered. There's we have persons who are in the professional field who use marijuana, who don't go out and rob and shoot and kill. We have persons in the professional field who use cocaine, who don't go out, shoot, rob. So it has to do, and I'm not recommending that we legalize either one. I'm just making a point that it depends, I think, upon a number of variables. There's a myth that if you smoke crack cocaine for the first time, you're going to automatically be addicted. That is absolutely not the case. But the social media and the media tends to put that out there, if you will, and we tend to buy it, even though there's not the evidence that supports it. So I think it depends on a number of variables. I'm not condoning the use of any illicit substances. There's a discussion taking place nationally that speaks to this notion that if a person is going to use illicit substances, they need to be educated about it. They need to be educated about the tolerance level. They need to be educated about how much you should take if you're going to ingest it that might avoid addiction, if that's possible. But those are discussions that are taking place right now relative to legalization. I would submit that eventually this nation will legalize marijuana for a number of reasons, and I'm not supporting it or any of this point, but I think that if we look at what's happened recently with the number of states that have legalized it, there's probably a trend that'll result in legalization. I think the South might be one of the last places to do it, but nevertheless, we see those discussions taking place nationally. And I agree with my colleague. A lot of it has to do with politics, our government, and a number of other variables.
Could you rephrase that question now again, please?
Well, just the idea of let's swing it even another way then. If we're picking marijuana to be legalized, the theory is that marijuana is just this harmless substance like smoking grass. That's what they call it. We're smoking grass. It's natural. It's an herb. I'm dealing with an herb, and people use it for cancer or some other type of ailments. Doctors prescribe marijuana. I heard somebody saying that the other day. Doctors prescribe marijuana, so therefore it must be good for you. It's something healthy. But mean old crack cocaine or heroin, those are horrible, and it's going to make people jump off a bridge and shoot themselves.
I think that if you view the history of like legalization of alcohol and use that as a precursor to the legalization of other drugs, alcohol, well, I want to say marijuana. Marijuana was sensationalized in the film industry in the 40s as a drug that caused people to become insane, do horrible things to people, jump out of windows, commit suicide, and it was highly sensationalized. And then in the 60s, you saw the hippie movement. People were using it to cool out, the peace signs, and so it changes with I think the times, and it is a situation that there is no final answer as to what the outcome would be. Studies show that there can be fetal damage, that there's a high level of placental transfer from a mother to an unborn child in utero. So there is no conclusive evidence as to the impact of legalizing marijuana. It has been shown that probably 20% or more of teenagers are addicted to prescription drugs right now, and a high percentage, probably even a higher percentage of children, teenage children, are using marijuana.
The 15 to 16-year-old kids.
That's right.
Using marijuana, and there's not a lot of research to back up for a parent. There are parents that are saying, "Hey, my son's smoking weed. Hey, I smoke weed. Let him have his way."
Right.
All right, but let's even swing there. Prescription drugs. Again, doctors prescribe prescription drugs. There's a governor in Vermont just recently devoted his whole State of the Union address to the problem of drug abuse, heroin abuse, in the state. And I'm almost sure that was Vermont, correctly, the state. But we look at prescription drugs where somebody gets in a car wreck, they have to go on hydrocodone, oxycodone. They might be that 10–20% that get addicted, and the doctor sends them to pain management. All right, they find that they don't know what to do at that point, but they go into this drug addictive behavior, possibly sending the doctor to prison and the patient to prison, and the only thing they were trying to do was cure a backache.
Right.
Let's talk about that.
Well, those are real issues that have to be attended to. Individuals who suffer from chronic serious pains do require, in some instances, prescription drugs to help deal with those pains. Part of the issue has to be with how do you discern the persons who need those drugs because they're treating a legitimate illness from those who are doctor hopping or searching for drugs because they enjoy the effects of those drugs.
Is there a difference, not to cut you off, is there a difference between the two?
Well, there's a difference in terms of legitimate motivations for needing to use it.
Help
okay.
Back
okay.
me up.
Well,
all right.
Some persons may start out with some pain medication that then they improve and don't require, but they become addicted to the use of the drug now.
Okay.
So they're interested in the drug not to treat the pain that they were originally seeking to get relief from, but they're treating the addiction.
Okay.
So they go to doctors and try to get them to write a prescription for, well, obviously one of the common ones is OxyContin.
Right.
And when that doctor decides, I'm not going to give you any more, they'll go to another doctor and they doctor shop. So their motivation has to do more with addiction as opposed to treating a legitimate medical illness. So
isn't the addiction a medical illness in and of itself to keep them from going to withdrawals?
Well,
and
the addiction, in my opinion, is a disease.
Right.
Okay, but
right.
What they're doing, they're attempting to, I think, find treatment, not to treat the addiction, but to appease the addictions that they're experiencing, because there are places that individuals who are addicted to drugs, not just prescription medications, but all sorts of drugs, can obtain legitimate treatment. So I think there's a distinction.
A distinction?
Yes, I do.
Okay, between the drug-seeking behavior to treat the addiction and...
As opposed to the drug-seeking behavior to treat a legitimate medical ailment, particularly pain.
All right.
I believe that it starts out many times as a legitimate problem, like from an accident or a fall,
right.
Or from just a pathological disease, like cancer.
Right.
And then it starts, then the misuse occurs, because if you look at how drugs operate in the brain, you seem to be able to handle stress and stimuli, or better handled, although you may be impaired, but it seems that you're doing better in life. Psychologically, you feel better for the euphoria. So that is one way that the misuse begins to become abuse. Then the abuse itself can, there are several variables that determine the level of abuse, going from misuse to abuse. But certainly there's genetic proclivity, inclination, okay. And then there's the environmental, and then there's just the pain itself, the root cause of the pain, like fibromyalgia is considered to be a pain in women that is nonspecific, that causes widespread pain at any time. Sickle cell anemia, another type of pain that will start suddenly and send you to the emergency room. You'll have to have an emergency room visit several times a month. One of the things that I find that in my research in the past is that people start off going to doctors for a legitimate reason, and when they can no longer get the prescription for Vicodin or OxyContin, then they end up in dark alleys and back streets trying to purchase an opiate to appease the withdrawal.
Heroin.
That's right.
All right. So the person with the backache or with chronic pain or whatever, and had lower back injury, they've tried surgery or didn't try surgery, they end up in the back alley purchasing heroin. I guess I'm going back to the concept of addiction being looked at as a sin, so to speak. Okay, I'm a bad person. Jail, that's where we're going to.
Yeah.
Prison for this one. But they're both getting high.
Part of I think our whole scenario in America is that we think that incarceration is the answer to any aberrant conduct. Many programs don't even have rehabilitation or intervention services at prisons. They go in, and the recidivism is as high as any incarcerated offense. Part of the problem, I think, we need to put into place treatment programs that are legitimate treatment programs, and just not warehouse people because of drug offenses.
But it's addiction, and again, I keep dealing with this individual who, if there was a drug that wouldn't get them addicted, that would treat their pain, they wouldn't have that problem.
Well, that's true, and that is part of That's
They didn't
part
prescribe
of
themselves as hydrocodone.
Yeah, I think that's part of the challenge of the medical industry. I think that's part of the challenge of the pharmaceutical industry. I would suggest that the human genome studies that are taking place currently are working towards identifying medications that specifically treats a particular ailment in an individual based on their genetic makeup. That will be more accurate in terms of the type of dosages that they will require. There's some discussion that through these genome studies that at someday we will be able to take a certain amount of lemon juice mixed with a certain amount of carrot juice, because all of these are chemicals, but based on our genome, put together concoctions that are not addictive, that can treat the symptoms that we're manifesting.
In the meantime, they go to Angola.
Well, in the meantime, they go to Angola, but they shouldn't,
But again, do people have a choice? And I guess that's where it goes into this idea of choice. Do they actually have a choice once they have the backache, or are they on the road, or some people on the road that there's no way that they can ever change?
Well, to say that narcotics are the only form of treatment for chronic pain is to say that there are no other avenues to treatment. Many times we rush to get Soma and Vicodin, Oxycontin, any opiate, but there are other drugs that are alternative treatments to pain. There are anti-epileptic drugs. There are antidepressant drugs that are quite effective for neuropathic pain, fibromyalgia. There are there are homeopathic remedies. I think that we're not expanding our search for alternative treatments enough, and that's why there's almost a linear relationship between the drug use and incarceration. As you said, it seems to be a large population. That's our solution. We need to do more research into alternative treatments. There's acupuncture for drug addiction. There are various types of treatments for chronic pain.
Well, let's stay with. Go ahead.
Let me just add to that, and forgive me for using improper English, but the United States is the most drug-using nation in the world. Okay. And part of that has to do with a mindset.
Right.
We want this quick fix. So your elbow hurts, you take a pill. Your head hurts, you take a pill. Your toe hurts, you pop a pill. And then that's coupled with a very powerful lobbying pharmaceutical group. One of the most powerful lobbyists in the world is the pharmaceutical companies. Well, now they go on TV and say, you need this for depression. So if somebody goes into a doctor's office and they ask for it, we, as my colleague mentioned, we have to absolutely begin looking at alternative methods of treatment. They're doing it in other places, but it's very profitable here to pop a pill. And until we can change some of that, we're going to continue to see this significant willingness to want to treat all of our ailments with a pill.
Yeah, what? Go ahead.
I think it keeps, if you look at the society in general, everything is moving at the speed of light. Right. Technology is moving faster than the frontal lobes of children can develop. Okay, the brain doesn't mature until about the age of 22. That's when it stops growing. You start using alcohol, cigarettes, caffeine, you're changing your entire psychological milieu, okay? And you're changing the way that you will behave as an adult. Children shouldn't use drugs. We're not saying they shouldn't use drugs. If they have sickle cell anemia, they may require drugs, but I'm saying that alcohol, there's caffeine addiction, intoxication, there's nicotine, has 500 different toxins in it. Kids start smoking in the bathroom at school. They start drinking at parties. They begin taking ecstasy at rave parties. Okay, and this cycle, and the only solution, once again, I see is incarceration, not remediation or rehabilitation.
Well, that's my point. I mean, you know, a weed head is the dumbest specimen on earth. You know what I mean, next to a monkey. You know what I mean?
Right.
When you think about it, you know, using that. But let's throw in real quickly. We have about 3 more minutes. The drugs that are used. The big controversy on what drugs should be used for chronic pain. Hey, Oxycontin, oxycodone, hydrocodone are standards, opiates, okay? But there's a controversy on, is there any data on whether you can use, they call it Xanax or Valium in addition to a muscle relaxant? There's a physicians go to jail for prescribing all 3 together, but physicians still prescribe all of them together, benzodiazepines and opiates.
That's a common cocktail. A benzodiazepine, an opiate, and a muscle relaxant. Okay, that's a common cocktail. Pain clinics commonly prescribe those 3 together.
Right.
The addiction potential increases, I think, 2-fold or maybe 3-fold when you add a combination of drugs that act at different sites in the brain.
Okay.
Okay. So going from misuse. You can go from misuse to, not misuse, but from misuse to abuse in record time. Okay,
but should they be prescribed?
Oxycontin is one of the common ones.
Right.
And so far we know that it interacts with some 675 drugs.
Okay.
Also. The real answer to that, I think, and that's an excellent question, I think the pharmaceutical industry in conjunction with the medical industry need to conduct evidence-based practices and research that looks at what is the best standard of practice for those kinds of combinations.
Right, but do we know yet though?
No, we don't know. In fact, we do know this, that prescription drug abuse is a worse problem than illicit drug abuse. We know that. And then we know that studies are not being done to dissect this problem. Okay, that once again, incarceration seems to be the alternative to rather than research. Research is not being funded properly to deal with the different populations that are being affected by drugs.
We got to do another.
Very quickly, it's being said on the street that the newest drug dealer is the home medicine cabinet.
The home medicine cabinet. Yes. Health issues, what you have to do is study. You have to learn. But we're finding out that those who're supposed to know, all right, concerning the research field has a lot more to learn. So in the meantime, do your best, work as hard as you can, and learn. Fight hard. Health issues. Thank you. Awesome.